a nonprofit that's dedicated to transforming sexual health and well-being in the United States through user-centered design and technology. And a lot of the reason that I do it is I grew up in San Francisco during the HIV epidemic, and sort of my city was dying around me as I grew up. And it was always an area that I cared a lot about. And as I sort of moved into adolescence and into my 20s, I came to realize that it was also sexual health issues that were really impacting me and my friends. And that it felt like a lot of the resources that we wanted just weren't there when we needed it, and particularly having to do with online resources that we were looking for. So I started up the nonprofit as a way to sort of provide those resources that I wish had been there for my generation.
Now, could you talk a little bit about the projects that are currently underway at Sexual Health Innovations?
Sure. So our first initiative is called So They Can Know, and it's a website that helps patients who've been diagnosed with STDs to tell their partners, either in person or anonymously. So it sort of gives people tips and scripts and videos about how to have that really awkward conversation with current and past partners when they get a diagnosis. And if they're just not willing to have that conversation, they can anonymously email and soon text message their partners to say, hey, you need to get checked out, here's what for, here's where to get tested near you. Our next initiative is Private Results, which is what I'm demoing here, and it is an open source STD test result delivery system. So we're working with the Baltimore City Health Department on it and helping them to deliver test results online or by 1-800 through an automated call-in system. So patients can get their results, they can really understand what they mean, and they can get linked to what next steps to do. And we allow providers to easily see who they need to follow up with and share data on the number of tests that they performed and diagnoses made with their local health department, state health department, and hopefully also the CDC.
Now, obviously, finding out you were diagnosed with a sexually transmitted infection, it's a very personal matter, much different than, say, somebody who finds out they have diabetes. Who, a diabetic patient would be more apt to share their personal health information with an app or a provider. So what have you seen with people sharing that kind of information? Are they willing to share that? Is that what you're seeing? Or
sometimes, and it depends on a lot of factors. So on average, when somebody's diagnosed with, say, chlamydia, they only tell 23% of their at-risk sex partners. People are a lot more likely to tell their current partner or somebody that they have a really strong emotional attachment with than sort of the more one-night stands, or if there was a bad breakup or a past partner, they're less likely to tell them. If it's something like HIV, people are more apt to tell their partners, period, both current and past, than they are with something that they consider less serious like chlamydia. But we find that the reason why people aren't telling their partners, particularly their past partners, often just has to do with that awkwardness. Sometimes they don't have their contact information, but often it's just they don't want to have that conversation. They just don't want to go there.
Now, are they willing to share it with you? I mean, like with the organization, are you seeing people do that anonymously?
Often, not always. I mean, it's hard to know when people are coming to our site exactly what is bringing them there and if it was a diagnosis or not. We find a lot of people look up information about how to tell their partners themselves more than the number of people that send an anonymous email through our site. When people do send an anonymous email to notify their partners, on average they send 2. But it's a very nice sort of curve from 1 to all the way out to 10, which is the max number they can send. So it depends. And people also can use their health department to notify their partners for HIV or syphilis. Most health departments provide anonymous notification for those STIs, but not other ones.
Now, you talked about your current projects underway. What would you like to see in the future? What's next for kind of leveraging mobile health for sexual health?
So some of what we're trying to build out for STI control is trying to figure out a continuum of care sort of for a patient. Can you easily know whether or not you're at risk of an STI? Find a testing site near you where you can get free or low-cost testing, get your test results, and be linked to either treatment or partner notification, which will cause your partner, hopefully, to go get tested, get treated, tell their own partners, and sort of cycle back through this network. So we're trying to make the whole process really seamless by either integrating with other people's technologies that sort of build in pieces of that, or building out those pieces ourselves. So a risk quiz to help you really understand what you need to get tested for, a test result or a test locator, things like that.
Okay. Well, very interesting. Thank you so much for speaking with me. Appreciate it.